Now quickly we are going to see the vitreous hemorrhage. Vitreous hemorrhage presents as sudden vision loss with floaters and pupillary afferent reflex defect. This is usually due to head trauma. These are the hemorrhages on the humor vitreous. These are very important hemorrhages because they are obstructing the visual field for that the patient presents with sudden vision loss. If we try to do a fundoscopic examination, we would not see anything. The fundus would be hard to visualize, or even though we visualize it, the findings would be obscured, and we need immediately ophthalmological evaluation or consultation. For patients who have underlying medical condition, we can give a more relaxed treatment, more conservative treatment. This would be that the patient should be upright while sleeping. For example, the defect in the pupillary reflex would be, remember, these are Marcus Gunn pupils. Very quickly, remember, we have the eyes. If we put light in one normal eye, there would be consensual reflex and direct reflex. The direct reflex is light is shown on this eye, then the optic nerve goes to the pretectal nucleus, from the pretectal nucleus to the nucleus of Edinger-Westphal in both sides, then to the ciliary ganglion, and then to the pupillary sphincter muscle. Constricting this pupil is the direct reflex, constricting this pupil is the consensual reflex. So if we put light now on an affected eye, there will be no perception of the light. Here is not because the optic nerve be damaged, but because it is obscuring the vision, so the patient cannot look to is not perceiving the light. So there would be no constriction of either eye when light is shown on the affected eye. But if we put light on the unaffected eye, we would see constriction of both pupils. If we pass from the unaffected eye to the affected eye, moving the light, we will see that because the patient is not perceiving the light, the pupils are going to dilate because they are returning to the normal position from a constricted pupil. So these paradoxical dilations that we see are called Marcus Gunn pupils, and we see this in every defect in the afferent or perception of the light, and in damage to the optic nerve. So the vitreous hemorrhage are emergency because obstruct the vision field, produce pupillary afferent reflex defect, and sudden vision loss.